The signs of an early pregnancy can vary from woman to woman. You may feel your body making changes quickly, or you may not notice any symptoms at all. Symptoms of early pregnancy can include a missed period. This is the most common and clear-cut sign of pregnancy. Once conception has happened, your body produces hormones that stop ovulation and the shedding of the lining of your uterus. This means that your cycle has stopped and you won't have a period again until after the baby is born. However, missing your period isn't always a sign of pregnancy. You can also miss your period from stress, excessive exercise, dieting, hormone imbalances, and other factors that might cause irregular periods. An increased need to urinate, swollen and tender breasts, fatigue, and morning sickness are the other common symptoms. How quickly can you know if you are pregnant? Some women may suspect they're pregnant within the first few days of pregnancy, while others don't notice anything until they miss a period. There are also some women who don't know they're pregnant until months after conception. The most clear-cut way to know if you're pregnant is to take a pregnancy test. When you take a pregnancy test, it's measuring a hormone called human chorionic gonadotrophin, or HCG. This hormone starts building in your body from the moment of conception, and will multiply rapidly in the beginning of your pregnancy. Despite its early appearance in the process, it takes some time for your body to build up enough HCG to register on a pregnancy test. Typically, it takes about 3 to 4 weeks from the first day of your last period before there's enough HCG in your body for a positive pregnancy test. When can you take a pregnancy test? Because it takes time for the hormone HCG to build up in your body, it's often best to wait till you miss your period before taking a home pregnancy test. Before this point, the test may come up negative, even if you are actually pregnant. Are home pregnancy tests the best way to check for an early pregnancy? Home pregnancy tests are generally very reliable. These tests involve urinating on a small test strip, and then waiting for a symbol to appear in the result window. This window will usually show a test image. Sometimes this is a single straight line. This symbol appears first and means that the test is working. Always check the packaging and instructions of your test to make sure it is working correctly. Within a few minutes, the test will show either a positive result or a negative result. Some digital tests will display a word or phrase whether you are pregnant or not pregnant. Blood tests for a possible pregnancy are done in your healthcare provider's office. This version of the test looks for HCG in your blood. You still need to wait for HCG to build up in your body before taking this type of pregnancy test. Your healthcare provider may recommend this option in some cases. Call your provider if you suspect you're pregnant and discuss the best type of test. Could you have the symptoms of early pregnancy and not be pregnant? Many of the symptoms of early pregnancy overlap with other medical conditions, as well as your typical menstrual cycle. Premenstrual symptoms can be very similar to pregnancy symptoms. This can make it difficult to tell the difference. You can also miss a period without being pregnant. This can happen when you exercise in extreme amounts, lose or gain a lot of weight, or even are stressed. Breastfeeding can also cause your period to stop for a while. The best way to know you're pregnant is to take a pregnancy test. If you have missed a period and think there's a chance you could be pregnant, consider taking a test. Hope this video may help you a lot. Thank you for watching and see you next time. Don't forget to subscribe.